I'm here to explain the causes and treatments for when we have a distended or bloated belly. Actually, if we look at the literature, we can see that there are 4 main causes described for this abdominal discomfort that many people suffer from. The first is an increase in the intestinal lumen, either due to gas or feces in the intestine. The second cause has more to do with difficulties in eliminating all the waste left after the digestive process. There is a third cause that is a paradoxical movement of the abdominal musculature, where there is a distension of the abdominal wall and an excessive contraction of the diaphragm that presses on the viscera, generating this distension in many cases. And finally, there is a last factor that is the sensation or increase in the sensation of bodily sensations in the abdomen, so that people feel they have a very full, very distended stomach, when aesthetically we don't necessarily observe it. Of these 4 causes, we will talk about the most common of all, which is abdominal distension due to gas accumulation. And we'll talk about this cause 1, because it is the most common, and 2, because it is the one that has the most to do with physiotherapy. We come across these types of bellies that surely sound familiar to you. And this is mainly due to the fact that the foods we consume ferment excessively. I want you to understand that apart from being related to an aesthetic problem and causing clear discomfort, from a physiotherapy point of view, it is a factor to take into account, because if we look inside the abdomen, like the one we have here, all the viscera are very well positioned, and the fact that there is an increase in the volume of the digestive system due to that accumulation of gas changes the entire body mechanics. So, let's see what happens for there to be that excess fermentation, that gas accumulation in the digestive system, which gives us these sensations of always feeling full, of discomfort that many people report. Basically, when we eat, we have to process the food so that it can be absorbed through 3 main factors. Number 1, in the stomach, we produce gastric juices, hydrochloric acid, which induces the pancreas to produce enzymes, called pancreatic enzymes, and the gallbladder to contract and produce bile that helps in the processing of fats. When this works well, everything is wonderful and fantastic, and the process properly absorbs what it should and eliminates the rest. When I don't process the food properly or I have more bacteria in my upper digestive system than I should, it's normal for the food to ferment due to the bacteria that are naturally present in the intestine. Therefore, the observation of this fermentation due to poor processing caused by not producing gastric juices, not producing pancreatic enzymes, or not producing the appropriate amount of bile, is what can cause an accumulation of too many bacteria in the upper part of the digestive system. If we look at the image, the famous intestinal flora, which is now so popular and helpful in so many ways, mainly accumulates in the lower part of the digestive system, while we have fewer bacteria in the upper part. When, for various reasons, there is a migration of bacteria from the large intestine to the small intestine, as we see here, what is in green is related to an increase in bacteria in that part of the digestive tract. When the bacteria move up to the small intestine, we start to ferment the food much earlier, and when the food ferments earlier, we have these problems of fermentation or gas accumulation. This is called small intestine bacterial overgrowth, which is currently a popular topic and is associated with many more serious digestive disorders. Therefore, we must know that one of the main causes of having a bloated belly is an excess of fermentation, with an excessive accumulation of gas in the stomach, which may not be very serious but is very uncomfortable. People who suffer from it feel a lot of discomfort. Let's observe that specifically, for the protagonist to facilitate fermentation. Number 1, as we've said, the stomach has to produce hydrochloric acid, which will allow for the degradation of the food. Then, for various reasons, for example, either because I have had an infection for a long time with the famous bacterium H. pylori, or because I have had an extremely unbalanced diet, usually associated with a low consumption of proteins, which are the macronutrient that stimulates the production of hydrochloric acid the most. Well, for example, due to the consumption of the so-called gastric protectors, which are actually inhibitors of gastric function. As it did not happen with the other protectors that will prevent the stomach from doing its job, and if the stomach does not do its job, number 1, more bacteria will enter orally that the hydrochloric acid will not kill. And number 2, since we do not process the food, it will tend to ferment. There are also many other causes. Any long-term inflammatory process in the stomach will have to do with the difficulty of processing food up here. When we notice this, we have some very basic interventions but, in many cases, very effective. Lemon juice as an aid, as a significant stimulus for the stomach, is interesting. Celery is also a good product for stimulating the production of hydrochloric acid, as are green leaves. Ginger is one of the therapeutic tools at this level that is most used. It comes from classical naturopathy, but currently it has been seen to have a very important capacity to stimulate the production of hydrochloric acid. It also appears that, although bitter flowers like boldo have more to do with choleretic stimuli, that is, with the production of bile, they also help in the production of hydrochloric acid. Therefore, if I want to stimulate the production of gastric juices, I can basically add a little lemon juice before meals and probably add some ginger or drink ginger tea with meals to process the food well and prevent fermentation. In addition to the stomach, we also have the production, if we continue down the digestive tract, of bile and pancreatic enzymes. To do this, we can usually stimulate it well with fatty foods. For example, the typical remedy of taking a teaspoon of olive oil in the mornings has to do with that. As we mentioned earlier, all bitter tastes are also choleretic stimuli. Ultimately, since bile, in addition to degrading fats, is a highly antibacterial element and bitter taste, from a biological point of view, we associate it with possible consumption of something that may be infected. So what we see is that in the face of that bitter taste we are going to release antibiotic mechanisms that will help us degrade food and also control that bacterial overgrowth we mentioned earlier. Therefore, this typical remedy of a teaspoon of olive oil in the morning is something that we can also integrate into our daily routine if we suffer from a bloated belly. In addition, this remedy becomes even more important if the type of gas we have when we expel it. We notice that, although it is a bit difficult to talk about this, doesn't smell much. The gases that don't smell, which are usually methane, are produced by bacteria called methanogenic, due to the production of methane, and are highly regulated by the production of bile. So, if we suffer from this abdominal distension with gases that don't smell much and we also have a bit of constipation because methane inhibits intestinal movements, peristalsis, you will see that this teaspoon of olive oil in the morning will be highly beneficial for us. And finally, we have to talk about bacterial overgrowth. As you can see here, what happens is that in the small intestine, these bacteria have started to accumulate, and even though I process the food well, the fact that I have so many bugs makes fermentation excessive. For this, great remedies have been proposed. Number 1, in 2012, a leading gastroenterology journal, the American Journal of Gastroenterology, proposes a diet that limits those foods that tend to ferment, called the FODMAPs diet. As you can find online anywhere, what this type of diet proposes is, among some fruits, choose those that ferment less than those that ferment more. Choose those vegetables that ferment less and eliminate those that ferment more, The same with those products that hinder the digestive process. So, they prefer to recommend that you consume some cereals better than others and also some sweeteners or others. Therefore, another good way to moderate this bloated belly that we are getting enough tools is to consume foods based on this diet that is now well known and can be easily obtained online. Called the FODMAPs diet. The other major cause of all this is understanding how the cleaning process of our digestive system works so that there are no residues left and bacteria do not accumulate. The responsible party, let's say, the garbage collector of the digestive system, is what is called the migrating motor complex. What the migrating motor complex does is, with certain contractions, eliminate the remains that are left after the passage of food bolus through the digestive system. That is, once the food has already been directed to the large intestine, we make some movements for those remains that have been left in the folds of the intestine. This is important because, for example, if I clean the house very well but then don't take out the trash and residues accumulate, it's normal for bugs to accumulate. Well, the same thing happens in our digestive system. In a place where there shouldn't be many bacteria, if the migrating motor complex doesn't function properly, it's normal for more bacteria than necessary to start accumulating. So, it's interesting to know how this migrating motor complex works. In fact, in the literature, there is a lot of talk about this process, the bacterial overgrowth of the small intestine. In addition to being suffered by many people, the recurrence rate, that is, the relapse after treatment, is very high. And it is believed to be related to a malfunction of this migrating motor complex. This complex is activated when it's been a while since we've eaten. Logically, the food must have already passed through the small intestine. Therefore, it is activated when we have an empty stomach and is completely inhibited at the moment we start the digestive process again. That is, at the moment I start eating again, the cleaning of the digestive tract stops because the digestive tract will have to start directing energy to process those new foods that arrive. So, one of the easiest and most effective interventions to decrease this fermentation due to an excess of bacteria accumulation is going to have to do with spacing out meals a little more. Many people who eat 5 or 7 times a day do not give their bodies enough time to activate the migrating motor complex, except at night. Unless, in many cases, there are people who even get up at night to snack, but well, that would already be an extreme case. A good way to facilitate cleaning mechanisms is to space out meals and focus on consuming 3 or even 2 meals a day, increasing the quantity but leaving space between them so that the body, once the digestive function is done, has time to clean up all the remains before food comes again. Therefore, it's very important if we want to decrease abdominal distension, to include spacing out meals a little more throughout the day in the process. In turn, basically the primary treatment for bacterial overgrowth is medical. An antibiotic is used to eliminate the overgrowth of bacteria that has occurred in the small intestine. The problem with antibiotics is their side effects, but fortunately, there is a study from Johns Hopkins University that compares the effectiveness of natural therapies with conventional antibiotic treatment and finds that the effectiveness is more or less the same in most cases. Therefore, the first choice of treatment should be natural therapy because it has fewer side effects. Essentially, what they observe to have a good effect is a combination of essential oils of thyme, oregano, lemon balm, and pau d'arco extract. Therefore, using these herbs either in the form of an infusion or as a supplement will also help us moderate this fermentation. This will postpone the fermentation that I have after eating. So, how do we gather all this information and what should I take home if I want to help someone or myself in treating abdominal distension? This may be related to a compromise in my back. I may have back pain because of abdominal distension, simply because I don't like having this 3-month pregnant-looking belly, or because it changes the mechanics of my body, or simply because discomfort is often the main cause or reason. In summary, if you want to reduce your bloated belly, you need to eat free of FODMAPs, free of foods that have excess fermentation, at least for a while. You should space out your meals. Take a teaspoon of olive oil with a few drops of lemon in the morning to stimulate bile release, and add thyme, oregano, and ginger infusions after each meal. And with this, in many cases, we will be able to solve that bloated belly that is so uncomfortable for us. And that's all I wanted to share with you. Thank you very much for your attention and see you in the next video.